Hello everyone, my name is Olivia and I'm a dental hygiene student at Cape Fear Community College, and I'm going to go over some adjuncts that you'll be using whenever you're brushing your teeth. Since we're all home now for a good while, it's a good time to take some interest into your oral health since you have more time on your hands. So we're going to go over some toothpaste, mouth rinses, toothbrushes, different types of floss adjuncts, and some type of daily routine that you should have. So whenever you wake up in the morning, you drink your coffee, you eat your breakfast, then you're going into your oral hygiene routine. And then at night after you eat your dinner, take a shower, brush your teeth, floss, all that good stuff. So I'm going to start with what normally I do. I wake up in the morning and I normally eat my breakfast and drink my coffee, getting ready before we go to school. And I have two types of toothbrushes that I'm going to show you guys. I have a manual and electric. A lot of people do like manual, but a lot of people are switching over to the electric toothbrushes. They are more effective in removing plaque and biofilm and helping your oral health. So we're going to go over the ways that we should use those. So first off, I have a manual toothbrush. You want to make sure you're using soft bristled or extra soft bristled. I wash my hands before all this. Make sure now you do wash your hands before you're touching your face or even touching your toothbrush, anything like that. You're going to make sure you're washing your hands very well. So this is the toothbrush that I have. I'd use this one a lot of the time. I do like more of a manual toothbrush, but you just want to make sure you're not pressing really hard. You're not scrubbing really hard on your teeth. So I'm going to kind of show you what I do. I'm just going to wet the toothbrush so it's not dry in my mouth. We'll go over some toothpaste too while we're at this. So I have my wet toothbrush, and I normally put just a little bit of a line on my toothbrush of my toothpaste. I've got 3 here at my house that I use kind of interchangeably. I have a trial size of Gum Detoxify. This is really good for anti-gingivitis. So it kind of has like a foaming effect, and it helps that neutralize the plaque bacteria around the gum line. So this is a really good one if you're starting to feel like your gums are really red and inflamed and bleeding whenever you're brushing and flossing. Try a trial size of Gum Detoxify to see if you see any difference. It's really good for that. It has fluoride, which helps with anti-cavity. So it helps with decay. A good layer of fluoride on your teeth helps prevent any type of acid to erode at your teeth and cause a cavity. So this is a really good one that I have. And then I do have Colgate Optic White. I use this on occasion just to help with keeping my teeth white. It helps with stains. It is fluoride, so it does have some fluoride in it. But I don't use this often. I like to have more aspects of my toothpaste than just whitening. So I use this sometimes whenever I feel like my smile is starting to get a little dull. And then this is my favorite toothpaste that we've got a trial size of. So I went out and bought a big size. This is a fluoride toothpaste, anti-cavity, anti-gingivitis, and it's for sensitive teeth. So some of my teeth are very sensitive. I had braces for 3 years, so that kind of can cause some sensitivity. There's some recession. So this is really good. It's like the Gum Detoxify, so it has that anti-gingivitis, anti-cavity effect, but it also has that part of that aspect of sensitive. So it helps cover those dentin tubules and prevents any sensitivity, hot, cold, anything like that. I'm more sensitive to cold, so I really like this toothpaste. So with my manual toothbrush, I'll use kind of any of the 3 that I showed you. And then I go in and make sure that my toothbrush is at a 45-degree angle at my gum line. You guys can see. And I wiggle it gently back and forth. You can make sure you're brushing for 2 minutes. So I just kind of sit here. Sometimes I play my favorite song. And then I go to the inside. Make sure you're getting the backs of your teeth really well. And then the biting surfaces of your teeth, because that's where you have those pits and grooves, and you want to make sure you get that any plaque out of there to prevent decay. So I do that all around, making sure I'm doing 2 minutes. And then for the insides of my lower teeth, I go like this. Since your toothbrush has a really hard time fitting like this and getting really good in there, you want to make sure you're sitting it up, brushing softly. Not a really hard scrub. A lot of people are taught circles. We like circles for children. It's easier for them to do it yourselves. There's not that many teeth. It's not that big of a surface to clean. So big circles for kids. And then make sure they get the inside of their teeth also. And at the end, you want to make sure you brush your tongue. That's where all the bacteria likes to hide out too. Since we have all those papillae on our tongue, we want to make sure we get them off. Good scrub on your tongue. Try to get back as far as you can. Some toothbrushes have a little tongue scraper on the back of them. That's really good. Or you can go buy a tongue scraper. You place it at the back of your tongue and you pull forward. So that was for the manual toothbrush. So now I have 2 electric toothbrushes that I have here. I did have a Sonicare, but I did give that one away to a family member so that they would be able to practice and use that. I'm going to first start out with the Oral-B. This one's really, really awesome for people that like to brush really hard. It has a sensor in there, so if you're brushing too hard, the light turns a red color. So it knows that. It's got a circular brush head like we use in the clinic whenever we're polishing teeth, so it helps get all aspects of the tooth. And it's got different settings here on the brush handle itself. It has different vibrating settings, and you can even connect it to your phone. And it's showing you the different areas that you're missing, if you're brushing too hard, if you're not brushing long enough. And it's really cool. They have an app for kids too. They also have an Oral-B Kids. So they have an app for that they have to brush for the amount of time for an image to show up. So it's really nice, and these brush heads come off. So you guys can share a handle if you're husband and wife, partners, whatever. You can share a handle, and everybody has their own different head, and it also has a different color aspect too, so you know whose is whose. And you want to change your toothbrush head at least every 3 to 6 months. If you're sick, you want to change it right after you're done getting sick. That way you're not introducing that bacteria into your mouth. So that's the Oral-B. It sits on a base, it's rechargeable. It usually lasts for a really long time for a charge. So yeah, that's the Oral-B. Pretty cool. And then I got this at a conference. It's the Burst toothbrush. It's kind of a new trend out there. It's a Burst toothbrush. So it's got a kind of a regular head like a Sonicare electric toothbrush would. So you can hear the vibration on that. And it also has a tongue scraper on the back. And then it's got different modes also, kind of like the Oral-B. Kind of a pulsating. More of just a steady one. And then it has a charger base too, so you know how to charge it. I like this one. It's very similar to the Sonicare. I like Sonicare over Oral-B. It's all about preference. You can also ask your hygienist what they think is best for you. So it's kind of like a Sonicare brush. Alright, so I showed you my brushing techniques. So I make sure I do 2 minutes all over my mouth, making sure I get every aspect, not brushing too hard. And then I go into flossing. Some people do floss and then brush. It really depends on what you want to do. I did want to show you guys this too. There's extra soft brushes out there. So if your teeth are really, really sensitive, you can get an extra soft brush. They have brushes that have more of a circular head, things like that. So just keep in mind for that too. And then with the electric toothbrushes, if you have a family member that has like dexterity problems that can't really hold small objects, the bigger handle of an electric toothbrush is really awesome to help them hold and be able to do on their own. So that's something that's really important for them too, making sure they're not putting a burden on you, that even though it's not really a burden, they feel like they are. Holding that toothbrush, being able to brush themselves is something that they really enjoy. Okay, so next I have some floss. I use whatever floss kind of comes in my little pouch whenever I go to the dentist. I do get some from school too. We get the little trial sizes, but this is Oral-B Glide Pro Health, and it's got a fresh mint flavor. There's some new tooth flosses out there that have different flavors, so if you're not a mint person, they've got some other kinds. So you get about 18 inches. It's a good amount of floss, and you're going to wrap it around your middle fingers. This way you're able to use your pointer and thumb and put it in between each contact. You want to make sure you're doing that, and you can even start flossing your kids' teeth whenever their teeth start to come into contact. That's awesome to remove that plaque out from underneath the gum line. So I take a good amount of floss, my pointer finger and thumb. I do have a retainer on top and bottom, so I'm not able to floss like normal with these, so I don't have any more floss threaders, but I can kind of show you what they kind of look like. I'll post a picture. So I take the floss and wiggle it underneath my gum line. And really make that C shape. That C shape is really what's going to help it go underneath the gum line fully and get all that bacteria out. And once you're done with that piece of floss, wrap it around one finger, let some go on the other, so you're not reintroducing that bacteria into the gums. So you do that between every tooth. Just make sure you're getting in between there really good. Some people like these floss picks. They're good for on the go, and some people that have dexterity problems, they can't really use their fingers very well. So these are really good. So these are kind of the same thing. Wiggle it into your teeth. And pull out. And I suggest you rinse after each time you use, just so you're not reintroducing that bacteria into your mouth. And then it does have a little pick on the inside that you can use if there's something stuck in your teeth. So there's also something cool here. This is a floss holder. So it helps with people that have dexterity problems there again, able to floss on their own. It's really cool. So you wrap it. You can ask for this at your dentist offices. Some offices have them, some don't. So just ask. It's sometimes tricky. And then that way, it's kind of like a floss pick, but it's easier for people with dexterity problems to get in there and floss. So there's that. So after I brush and floss, I do use mouthwash. Mouthwash, this is a little trial size that I got, so I'm going to go use that. It's Crest Scope Outlast. With mouthwashes, if you have dry mouth, you want to try Biotene. You don't want a mouthwash that has a lot of alcohol. Alcohol causes dry mouth to worsen. So if you're experiencing dry mouth, you want to make sure that you're using Biotene or an alcohol-free mouth rinse. These mouth rinses help remove any bacteria that you missed or is kind of hiding out in your gum line after you brush and floss. So any type of little mouthwash, you just want to make sure that you take a good amount in your mouth, swish it around for 30 seconds, spit it out, and then I like to do it again. So I like to do swish for 30, spit, and then swish for 30, and then spit. That way you're making sure you're getting everything out. So I'm just going to kind of show you what I do with mouth rinse, make sure we pull through all of our teeth, make sure we get it really good. I'm not going to do it for 30 seconds, but I do it for 30 seconds. And there you have it. So if you have any problems with cavities, a fluoride mouth rinse is really awesome. Sorry, I'm going to spit again. A fluoride mouth rinse is really great. It helps put some fluoride on your teeth, along with fluoride toothpaste to help prevent that decay. So those are all the adjuncts, and I always finish off with chapstick. I'm kind of a chapstick fiend. It's really good to make sure that your lips are nice and moisturized. That way you're not getting those little red little cuts inside of your mouth that can cause infection, bacteria to get in there, fungal infection. So you want to make sure you're keeping your lips really moisturized. So that's my routine that I do in the morning, and that's kind of the standard routine. Some people have water picks, which they're not really able to do the normal flossing, which is really good, so you can go in there and kind of just flush in between the teeth, but make sure you're getting some direction from your dental hygienist or your dentist about using the water pick. That way you know how to use it correctly. Using any of these adjuncts wrong can cause trauma to the gums, and that's something that you really don't want. It can cause a little cuts in the gums, which can cause infections. It can cause, if you're not properly using them correctly, it can cause some decay or plaque to build up. So you want to make sure you're using them correctly. Another thing I would like to talk about is oral cancer screening. This is really important. You want to make sure that while you're brushing your teeth, you can kind of look at your face for any freckle, anything that doesn't look right, red, irregular borders, rays, kind of changing each time you look. You want to make sure you're checking on that. You can bring that up to a dermatologist, but sometimes at the clinic, we do oral cancer screenings every time a person comes in. So we like to check these things, and if there is something that we do see, we keep an eye on it. If it has changed from the time that you are in the chair to the time that you leave, we have an multiple appointment process, so we get to see the patients multiple times. So we like to keep an eye on those things. Oral cancer in the mouth likes to start on the sides of your tongue. So whenever you're brushing and you're brushing your tongue, just kind of stick your tongue to one side or the other. It really helps you see the sides of your tongue. You can even kind of pull your toothbrush to the side. That way you can pull your tongue with your toothbrush to the side, so that way you can kind of really see the base of your tongue. That is where oral cancer likes to start. So if you see anything that's really kind of abnormal, it's never really been there before, or it's starting to change as you watch it, then you definitely want to call your dentist or your medical professional. That way you can just kind of get in there and they can test it to see if it is some type of oral cancer. And if it isn't, that's awesome, but you always want to make sure that you're doing okay with that. You can also check your lymph nodes for any type of oral or any type of cancer. So you just want to palpate, make sure there's nothing really hard, tender, anything like that. In the back also, because you have nodes back here, so you want to check that all the way down into your chest area. Feel those. Just make sure you're not feeling anything tender or hard, anything that's kind of abnormal, and if anything grows, then you want to make sure that's something to look forward to. I appreciate you guys listening, and I hope you guys have a great day. Bye-bye.